Hi, my name is Pamela Cipriano. I'm a doctorally prepared nurse practitioner at the Practice of Health and Wellness in Thomaston, Connecticut. May is National Lyme Disease Awareness Month. Lyme disease is only one disease process that occurs when you get bit by a tick. One tick can carry up to 14 different diseases. Lyme disease, however, is the most common bacterial infection that we know about that does come from a tick bite. The goal of the awareness month is to help people figure out how to prevent a tick bite. But logically, that is literally impossible. The tick is the size of a pinhead. It's something so small you'd barely be able to see it if you were lucky to see it at all. Unlike what we've been told in the past, ticks do not have to stay on you for 72 hours to transmit disease. Ticks don't have to stay on you for 24 hours to transmit disease. Ticks, like any other insect, can bite and release. The longer they stay on you, the more disease and bacteria you do get. So the longer the tick is on you, the sicker you're most likely going to get. However, a tick that just bites and releases, you're still going to get an infection. I don't know what the actual percentage is now as far as ticks go, whether it's 80% of all ticks are infected or 50% of all ticks are infected, and I don't think the data is out there, and I'll tell you why. When you send a tick to get tested, if it does bite you, they're not checking for all 14 different diseases that one tick can carry. Some labs only check for Lyme disease, other labs check for Lyme, babesiosis, and many times they don't check for Bartonella because it's not that well known that a tick can carry Bartonella. Bartonella is mostly associated with spider bites, fleas, and cat scratches, but ticks can carry Bartonella, and Bartonella, not that I have a favorite disease, is my least favorite because of the neurological complications it can cause. So, since May is Lyme Disease Awareness Month, I'd like to take an opportunity to talk about some of the symptoms that you can experience if you get bitten by a tick. And it doesn't mean you have Lyme disease, but it does mean that you do have one of the tick-borne diseases. Generally, what I find is a rash is a godsend if you get a rash after a tick bite, because only 20 to 50% of people actually get that rash, any kind of a rash. And it doesn't have to be an exact bullseye, and it doesn't have to have the multi-layers of circles. It can look like a patch. It can look like ringworm. It can look like cellulitis. It can look like almost anything. We had a young boy in the hospital when I was working as a hospitalist. There was a very smart nurse practitioner who identified when she walked in to see the young man, she just caught his abdomen at a certain angle and saw a very, very faint, very, very large erythema migrans rash, which is a bullseye rash. And if she didn't catch it at that specific angle, I don't even know if we would have ever found that he actually had Lyme disease, because all of his tests were coming back negative and he was extremely sick. So the most common symptoms I see after a tick bite are sometimes fever, sometimes joint pain, almost always joint pain. But then it depends on what diseases that one tick carries. Some of the common ones are brain fog, forgetfulness, your short-term memory isn't as strong as it used to be, forgetting names, for example. People will experience fatigue, profound fatigue for no reason whatsoever. And these, think about these symptoms can be almost anything when you think about it. So if you go to a provider that is not really educated on tick-borne diseases, you're going to be diagnosed with 1,000,001 different things, and Lyme disease or tick-borne diseases, any of the co-infections, are going to be on the bottom of that list. So what I would really strongly recommend is if you think you got bit by a tick, or you saw a tick climb out from under your clothing, like this just happened to one of my patients, make sure you call the office. If it's not me, then another Lyme literate doctor you should be calling so that you can set up an appointment and see if you do have a tick-borne disease, because the mainstream providers, even in the state of Connecticut where Lyme originated, do not know the first thing about Lyme disease except what they're told by the CDC, and unfortunately the CDC is behind the 8 ball on this one. So what I would recommend is making an appointment, getting tested the proper way, and getting put on treatment immediately. Because the sooner you start treatment, the quicker you're going to get your life back. Don't wait. Waiting is the worst thing you can do for a tick-borne disease. This can turn into a chronic illness. Back in the 90s, there was a commercial, an advertisement in the magazines. I belong to ILADS, the International Lyme and Associated Disease Society. One of the physicians happened to still have this advertisement from the 90s in a magazine and shared it with us. Everything about this advertisement was about getting the LymeRix vaccine that was out back then. And because if you do get bit by a tick, this vaccine was going to help prevent chronic ailments following Lyme disease. So the information is out there. When there was a vaccine, they knew that there were chronic symptoms you can have if you did not get treated promptly. The problem is that what providers know about treatment is skewed, and it's so antiquated, it's so old. You know, the 2 doses of doxycycline do not do anything but maybe give you a little tummy ache. It's not, 2 doses of any antibiotic is not going to stop Lyme disease. You have to be on a tetracycline type of antibiotic for a minimum of 30 days because you want to get past that 3-week cycle. I mentioned this in a previous video, but I think it's worth repeating. When you get bitten by a tick, the bacteria comes up from the stomach into the mouth of the tick and gets injected into your system. That bacteria is encompassed in saliva of the ticks and causes it to be hidden from your immune system by approximately 2 weeks. So for the first 2 weeks, for the average person, they don't get the bullseye rash because the immune system doesn't even know that there's anything going on in the immune system for approximately 2 weeks. Once that occurs, the bacteria within the first 24 hours uses your proteins to create a biofilm where the immature cells and the persister cells can hide from the immune system. And it could stay there for a prolonged period of time, especially if you have a strong immune system. However, as soon as something horrible happens in your life, some kind of a traumatic stressor, that biofilm will break open and your body will be inundated with bacteria. So the reason you have to be on the antibiotic, a tetracycline antibiotic, so either tetracycline, minocycline, or doxycycline, for a minimum of 4 weeks is you want to cover that 3-week cycle, because every 3 weeks, some of the bacteria will mature and come out of the biofilm. And if you don't cover that 3-week cycle, you've kind of missed an opportunity to get rid of Lyme disease for good. So do yourself a favor. If you feel like you may have a tick-borne disease, whether it's Lyme disease, Bartonella, Babesia, tularemia, Brucella, ehrlichiosis, anaplasma, I can go on and on and on. Give the office a call, 860-880-2525. We're located in Thomaston, Connecticut. We see people from all over the country, so you don't have to live in Connecticut to make an appointment with us. I have to see you physically once a year in my office. Otherwise, we can do telehealth visits. I can mail you the labs that need to be done. I can work with you with payments. I really want you to get better. That is my goal. I hope to hear from you soon.